community health nursing, what you are going to formulate is the so-called family nursing care plan. The process itself is similar somehow with the individual NCP that you will be performing, no, for your individual patients. So, however, we have a separate guide in the formulation of our FNCP. Medyo may konting twist lang, however, we would always follow, okay, the steps, no, in the formulation of our family nursing care plan, just like in our individual NCP. So we have right here the definition of what is a family nursing care plan. So the family nursing care plan, we consider it as a blueprint in the care, which is designed, of course, by nurses. So if we say blueprint, that would mean it's a design for us, no, to be guided on what we are supposed to do with our client in the community. So particularly the family. So it is done systematically to minimize or eliminate identified health and family nursing problems. So if it is done systematically, obviously, there are a series of steps that we need to follow in the formulation of our FNCP so that we can formulate an FNCP which is, of course, tailored, fit according to the identified health problem or family nursing problem of our patient. So in our family nursing care plan included right there is, of course, there is a specific, okay, formulation of our outcomes of care. So we have goals, we have objectives, we have set of interventions. Now we need to identify resources that is needed, no, in the process of implementing this intervention. And obviously, we have also our evaluation. So how do we evaluate the family? Now that would depend upon the previously set criteria, which is of course stated in our objectives. Now, we make use also of some baselines, like for example, standards, no, that we have to follow. Like, let's say, for example, the BMI of the patient. So let's say if majority of the patient has a problem pertaining to obesity, then we follow the standards in terms of making comparison whether there would be, let's say, improvement or perhaps, okay, the situation of the family gets worse. So things like that, no? So we utilize, okay, standards, tools in order to evaluate what is the outcome of the interventions that we have implemented. But basically, doon naman talaga tayo bumabalik sa ating previously set goals whenever we're going to evaluate our FNCP. So let's go to the steps in the family nursing assessment. So in conducting or in the formulation of the family nursing care plan, the very first step that we need to do is to conduct assessment. So assessment, this involves series of actions for us to determine, okay, how the family is functioning as a system. Okay, so how they function as a unit, how they were able to perform, okay, activities in order to promote their health, okay, prevent illness, and then in the event that they have already, or let's say any member of the family is already infected with certain diseases, how would they restore, okay, that health of the particular family member, okay, how they make use of the facilities that is available, so things like that. So basically, with assessment, we can identify what is the existing health problem of the family, what are the potential health problems. So in nursing assessment, this involves, of course, data collection. So for data collection, we will be utilizing the first level assessment wherein the tool that we are going to use is our IDB or our initial database. So when we gather data, okay, so sa first level assessment, ang ginagamit po noon ay ang ating IDB. Now, this involves gathering of 5 types of data which will generate the categories of health conditions or problems of the family. So this data would include the following. So ito na yung sinasabi ko sa inyo with your family assessment guide. Now, the data are being categorized into 5. So you have data pertaining to family structure, characteristics and dynamics, socio-economic and cultural characteristics, home and environment, health status of each member, and values and practices on health promotion, maintenance, and disease prevention. So ang kakailanganin nyo dito sa inyong data collection for you to determine what is the health problem of your patient is your IDB or initial data database. Okay, klaro po ba? Now, to make it a little bit convenient on your part, so you will be given a copy of your family assessment guide. FAG po ang guide natin dito. Okay? Pero kung gusto niyo talagang walang ma-miss out, puntahan ninyo ang inyong initial database so that you will not miss anything regarding the different data that you have to gather according to these 5 categories. Klaro po? Now, after we gather the data, okay, na-gather na po natin ang ating data, kompleto na. From 1 to 5, there would be series of questions or information that you need to gather from the family. Now, we will proceed to, okay, may ano pala ako dito. Now, in gathering data, these are the different methods that you can use. So, number 1, of course, we can just simply observe the situation of the family. Like, for example, among the 5 categories of data, now you can observe the home and environment. So, yung sabi ni Ma'am Fuentes kanina, we really have to go to the area wherein the family is situated. So, kinakailangan natin mag-observe. So, sometimes there are things that requires no questions at all, but then titingnan mo lang. Okay? The relationship of the family, their dynamics, the way they would interact with each other. So, kinakailangan mo lang i-observe, okay, during the process of conducting the interview. So, kahit hindi mo itanong, nakikita mo na kaagad. So, this is one method of data collection. So, you just simply need to observe, okay, the home and environment, for example. Now, we need also to make use of another method of data collection, the physical examination. So, particularly, if you notice that there is already an existing health deficit, okay, in the family. So, kunyari, meron na talagang sakit, so you need to conduct physical examination. So, in our case, we are looking for a pregnant mother. So, yun ang sabi nga namin, dito sana, in data gathering, it's not just basically observation that you need to do, but then since we have a family member who is pregnant, we will be conducting physical examination. Okay, or cephalocaudal examination has to be conducted. However, with the situation right now, so medyo we are going to set limits so that less contact with the patient and then less probability that we can also have diseases, because we do not know the situation. So, yun po. Kung halimbawa naman, ang case naman ninyo in a family, yes, there is a pregnant mother. Focus talaga natin is pregnant mother. So, dito, physical examination ang nanay lang talaga. Now, later on, sa CHN 2 ninyo, which is your IMCI, ang focus naman doon, if there would be a family member, okay, a child who is sick, having those main symptoms like cough, fever, yun naman po ang i-assess natin. So, anyway, these are just methods of data collection. And number 3, interview. Okay? So, especially if the information that you have to gather has something to do with the values, the practices of the family. Okay? And then, what about the, yung mga health history nila? Okay? So, kinakailangan po talaga nito interview. Hindi naman pwedeng i-observe mo lang ito. Okay? Kung tatanungin mo sila, like for example, pertaining to the genogram of the family, the Ecomap, ganyan, kailangan mo silang tanungin talaga. So, hindi pwedeng i-observe mo lang ito. So, that's why you can make use also of this method of data collection. Another would be record review. So, if we have access to the records of the patient, if we are allowed, okay, to get hold of the record of the patient at the health center, then we can actually make use of it as our source of data. So, pag nagpaalam tayo doon, pinahiram sa atin, pinakita sa atin yung record ng pasyente, then we can copy some relevant information pertaining to the health status of the family. Kasi may family record man yan sila doon, may family number, naka-envelope po yan doon sa ating mga health centers. So, pwede po natin siyang gamitin, in terms of data collection. Then another thing, if there would be any available laboratory or diagnostic test. So, pwede rin po natin siyang kopyahin. Now, in our case, what we can perform is only urine testing. That result of the urine test of our pregnant family member, okay, has to be recorded as well because kakailanganin po natin siya, especially, okay, in our, parang hindi naman talaga siya physical examination, but then we can include that as well, the findings of the test that we have conducted. So perhaps that can give us some information pertaining to the current health status of a family member who is pregnant. Now, other than that, kung meron silang available na mga lab test, diagnostic test, pwede nating hiramin. Magpaalam lang po tayo, kopyahin natin kung ano ang results. So, especially if there is already an existing illness, may health deficit na po talaga yung isang family member. Okay? So, syempre, family ito, they function as a unit, it's a system. Therefore, if somebody is sick, that might also affect the rest of the family members. Okay? So, meron talaga yun siyang impact with the rest of the members. Now, after data collection, so yun po siya, yung mga different methods natin wherein we can be helped in the process of data gathering. Now, what we are going to do, all right, nandiyan na po yung data, nag-gather na po natin. We were able to conduct already our interview, observations, so record review, everything, no? So, pwede naman combination ng mga sinabi kong mga methods of data gathering. We will proceed with data analysis. So, there are sub-steps that we need to follow in analyzing the data. So, first thing that you have to do is to sort the data. Sorting of the data according to the 5 categories. Okay? So, ano nga yung pinakauna na category natin, students? Ano yung first category natin sa IDB? Initial database. Miss Villaraza. Family, structure, characteristics, and dynamics. Diba? Pwede? So, we sort that data according to the following categories. Another one, Miss Arsenio. Sa IDB natin, ano yung second category po? Kung may hawak kayo dyan na list, or hindi kayo antukin, tingnan ninyo. After nung ating family structure, characteristics, and dynamics. Diba we have socio-economic and cultural characteristics. What about the third one? Hello?
Home and environment
factors
Yes,
po, ma'am.
very good, no? So, home and environment naman tayo. After ng home and environment, Miss Labay.
Assessment of each member po.
Okay, home and environment. We have the health status of each family member. Next to that, we have
Values and practices.
okay, values, practices, and health promotion. So basically, that's how we sort the data that we have gathered. All right. Now, after that, we are going to cluster. When you say clustering, you group together all the related data. Okay, group it together. Alam niyo yan sa ating individual NCP, you do clustering. Kaya nga lang, ginagamit natin sa individual NCP is Gordon's functional health patterns. Dito, ang gagamitin naman natin, we cluster all together those related data which is being sorted already according to the 5 categories. Okay, so kunyari, home and environment. Okay, so cluster all of those data that has something to do with the home and environment. However, the third sub-step would be to distinguish relevant from irrelevant data. Not all of the data, okay, pertaining to home and environment are considered to be relevant. Okay? So, hindi naman lahat isusulat mo yun eh. So, you have only to get what is considered to be relevant. It will be pointing out to a particular health problem. But if, let's say, for example, okay, wala namang problema doon. Para bang vital signs, everything is normal. So, well, it cannot support the identified problem, no? So, kaya, huwag mo na siyang isali, hindi naman siya makakasupport doon. So, that's the meaning. When you say relevant, irrelevant data, whatever is irrelevant, okay, you remove it. So, do not write all together. Noon kasi, binibigyan lang namin ng case scenario yung mga students. So, ginagawa nila, pagdating sa quiz, pinakyaw nila lahat ng data. Bakit pinakyaw? Bakit sinulat niyo lahat? Ma'am, para walang ma-miss po. No, hindi po pwedeng ganun. So, you group together the data and then you try to distinguish which one is relevant, which one is irrelevant. Now, after determining, okay, those relevant data, you are now going to identify patterns. So, what do you think is the pattern, okay, that is present on this data that I have gathered? Well, this has something to do ba with lifestyle ba ang problema? Will it have something to do with behavior ba ng pasyente ang problema nito? Or there is problem in terms of function, okay, of the family? So, yun po yung titingnan natin. Halimbawa lang dito sa picture, no? So, what have you noticed right here? Etong isa, physically fit. Samantalang itong isa naman is mataba. Like siguro overweight siya or obese yung pasyente natin. So, prior to, of course, no, identifying, okay, that particular problem. So, nakita na natin, like, we identify the, let's say, behavioral pattern in terms of food intake. So, nakita natin doon, like, they're eating too much. Okay? The kind of food that they're eating is not of good quality. The amount that they consume is too much. Okay, let's try to check the pattern of their, let's say, lifestyle nila. Okay, so most of the time, wala naman silang mga activities, no exercises. They just keep on eating. So they have sedentary lifestyle. Okay, ngayon, ito, lumaki na ang katawan. You try to take the weight of the patient. You try to check the height of the patient. I mean, not just the patient, but let's say, for example, si nanay mataba, si tatay mataba. Yung may mga anak din sila, malalaki din, mga overweight din. So, kaagad makikita na natin yung pattern. What do you think is the problem? No? There is something wrong. Okay, when it comes to the nutrition of this family, there is something wrong. Malnutrition. So, they eat that much, they have less activity. All right? Tapos, they don't mind doing something about it. Okay, they think it's cute, no, to have children who are mataba. Example, yun ang kanilang thinking. That's how they see things, no? So, based on your interview. So, from there, okay, pwede na natin i-compare yung patterns na nakita natin with their behavior, their lifestyle, okay, the way they function with the standards. All right? So, for example, doon na natin i-compare. Let's check the BMI. They happen to consider, okay, the situation as something that is normal. They find it cute, no, to have children na matataba. But then, when you try to compare, okay, the BMI from that of the standards, nako, overweight na. Okay, yung nanay, obese. Yung tatay, obese din. So, mga anak niya, overweight din. So, we can now identify, okay, what is the problem? We can interpret now the result. So, kung halimbawa, obese sila lahat, diba? Obesity that is already considered as a health deficit. Okay? So, nakita ninyo, so makikita mo na ngayon ang problema ng pasyente mo. Okay, this is the interpretation. With these patterns, okay, of their behavior, their lifestyle, we can already identify that this is the problem of the family. Okay? So, next to that is you have to make inferences or conclusion. Bakit umabot sila sa ganitong klaseng problema? Why they have this kind of problem existing in their family? Okay? So, they are supposed to take good care of themselves. So, you have to remember, diba, ang family may mga health tasks po ito na dapat nilang ginagawa. Okay? So, bakit sila naging obese lahat? Ano kaya? Hindi ba nila alam ang consequences nito? Okay? Do they lack knowledge about it? Or they just simply, yung bang they don't see the magnitude of the problem. Yung salience nila is sobrang baba. Okay? Tingin nila dito, okay lang, normal lang ito. Mas maganda nga itong mataba kasi healthy. So, iba yung kanilang perception regarding the problem. Kasi, di ba, sa family kasi, or in the community, the perception of the family might be different from our perception. We consider it as a problem, but the family does not consider it as a problem. Now, dito sa inferences or conclusion, dito natin i-identify what is the reason bakit they failed to do their task as a family to maintain, okay, and promote health within its family members. Why would they allow this thing to happen? Okay, bakit sila na lahat? Puro na sila overweight o may obese na nga sa kanila. Okay, but nahayaan nila ito. They failed their task to maintain, okay, the health of every family members. So we make now inferences or conclusions based, okay, on the data that we have gathered. Okay? So sa interview nyo, malalaman nyo naman kasi anong reason nito. Ay, kayo na ako, ma'am, normal lang ni siyang ingon ani. Okay? Kanang cute magod kung tambok among mga anak. Daghan kaayo mo kuan niya mo praise sa iya. So proud kaayo ni sa iya nga tambok siya. So ana na ilahang thinking, no, regarding this particular problem. They don't see it as a problem at all. They lack knowledge. Okay? Or dili jud ako mapugnan akong anak pangud ma'am dahil kay gulo akong bana pod lami jud kayo ikaon ma'am. Dili jud namo mapugnan namong sarili. Sige ra gyud mig kaon. Okay? So ana ba ilahang mga rason? So things like that. So we need to figure out, we need to make a conclusion. So that after letter B, ang gagawin na natin is to define the problem, or we have to formulate our nursing diagnosis. Okay? So, dito po sa problem definition or nursing diagnosis, so we are going to consider now the findings of our assessment, first level assessment. So, dito, we're going to identify what is the potential health problem or existing health problem of the family. So sa first level assessment, ang gagamitin na po natin dito is the typology of nursing problems. Okay, please check it out if you have your copy regarding the first level assessment. Do you have it with you, students?
Yes.
First level assessment. Sino may copy po? Meron ba? Sa inyo? Or baka binigyan kayo sa Quiper, hindi nyo lang naman i-check doon. Well, anyway, doon po sa first level assessment natin, okay, yes, Mr. Gestosani.
Yes pa, ma'am. Pertaining to your question kung sino nang may copy on the typology of nursing problems. We have
Okay,
po,
so,
ma'am. We were given po.
Okay, so you are holding it right now, the copies?
Soft copy po siya, ma'am.
Okay, soft copy. So from time to time, you can check it din naman, no, while we are having this lecture. So dito, you are going now to classify the identified problem. Whether it is potential problem or existing health problem, you need to categorize it. Okay? So what are the categories that we have under first level assessment? So halimbawa na lang ang nakita mo doon. Okay, pagpalagay natin. Nag-measure ka ng total floor area versus total space requirement. So it was found out na kulang po sa space ang family members. So they are just simply using a multi-purpose room. Okay, parang box lang ito, parang kahon lang, and then there are 8 family members. Yun ang nakita mo doon. So agad-agad, di ba, makakapag-identify ka na ng problem. Okay, so based on the list, if you have your typology, the problem would be, haman banda be, kita ninyo, it is inadequate living space, diba? So, ang pagka-state po niyan, okay, poor home condition, specifically, inadequate living space. As, saan po siya nabilong? Health threat. Okay? Ganun po siya. So, ganito students. So, ito po yung mga categories po ng ating mga potential and existing health problems. Well, hindi naman pwedeng lahat na lang na makikita natin could be considered as a problem. Now, we also have a category of data wherein we can classify it as presence of wellness condition. So, when we say presence of wellness condition, this is stated as potential or readiness, a clinical or nursing judgment about a client's transition from a specific level of wellness or capability to a higher level. Now, let's say, for example, that family, they too have a family member who is a mother, no, for the first time. Okay? Kunyari, may isa silang, kunyari, extended family ito, yung kanilang eldest son nakapag-asawa na, okay? At bagong panganak lang. And then, nagpapa-breastfeed po itong nanay. So, nag-breastfeeding siya. Right? So, I think there's nothing wrong with that, no? Diba? We are promoting breastfeeding naman talaga. So, in fact, exclusive breastfeeding pa kung pwede. So, nakita mo ngayon doon. So, it's not actually a problem that you see, okay? Because that family member is breastfeeding her newborn. Now, that could be classified as presence of wellness condition. Okay? Pero, we can categorize it into 2. So, according to your judgment, o nakita mo doon, may potential kang nakita doon sa isang family member na nagpa-breastfeed. Now, we try to categorize this wellness condition into 2. Wellness potential, or it could be readiness for enhanced wellness. Now, when you say wellness potential, based on your nursing judgment on a wellness state or condition, okay, your basis for this, of course, is to what? The client's performance of the action. Nakikita mo, nag-breastfeeding siya, may kakayanan siya, healthy naman ang nanay, wala naman po siyang sakit. Kaya nga lang, there is no explicit expression of client's desire to continue it. Nakuha ninyo? So, according to your judgment, okay, there is a wellness potential that is present within that family member breastfeeding, okay, her newborn. Kaya lang, walang exact expression of the desire to continue or to enhance further that particular action. Nakuha po ninyo? So based on your observation, there is a wellness potential. However, it's different when you see readiness for enhanced wellness. All right, according to your nursing judgment, okay, you see that the client or that particular family member is able to perform the activity, okay? So competent naman, marunong naman siya, healthy naman ang nanay, wala naman po siyang sakit. So pwedeng-pwede po talaga siya mag-breastfeeding. And at the same time, there is an accurate or exact expression of client's desire. Halimbawa, sinabi pa ng nanay na yon sa iyo na, Ma'am, gusto pa ko nga magdaghan pag yun ang gatas nga ako ang ma-produce. Unsa man akong angay buhaton, ma'am, para mag-increase pag yun akong milk production. Ma'am, gusto ko dun ta ako mag-store sa ako ang breast milk para dili masayang kay daghan man pud siya kaayo sa natanan, ma'am. So unsa akong angay na buhaton? So you see, there is an accurate or exact verbalization coming from the client expressing desire, okay, to achieve a higher level of state or function. Nakuha po ninyo, students? So, however, never pa ako naka-encounter na ang nakita namin doon is wellness. So, mostly, ang nakikita po talaga namin doon sa mga family namin would be health threat. Okay? So, health threat are conditions conducive to disease and accident or may result of failure to maintain wellness or realize health potential. For example na lang, let's go to home and environment. Improper garbage disposal. Diba, that could be considered as a health threat. Nakuha po ninyo, students? Now, if they will not do something about it, most likely, okay, it may lead to the probability that the family members might develop diseases. Or what you see right there in the house, ano naman itong kanilang hagdanan? Okay? The materials that are being used is no longer stable. They are at risk, no, for, let's say, accident. Okay? Like fall, for example. Yan, napanjoy buntis na yung mga bata na family members, may elderly kasi nga extended yung family. So, what you see is presence of health threat. Nakuha po ba ninyo, students? Now, another naman, category of the problem that you have identified, it could be presence of health deficit. Now, pag sinabi natin health deficit na po, there is already a failure in health maintenance among the family members. It could be that one family member is already diagnosed with a certain disease. Okay? May sakit. Okay, there is an illness, whether it's diagnosed or undiagnosed. So, if there is already a failure in health maintenance, kahit hindi po siya diagnosed, sabihin na lang natin, inubo. Okay? So, may ubo yung dalawang anak. Okay, cough is already considered as health deficit na po yun. Okay, kahit hindi naman po yun na-diagnose kung ano ba, pneumonia ba yun, ano ba, upper respiratory tract infection ba, or ano ba siya, systemic viral infection ba, whatsoever, wala pang diagnosis. Pero the fact na inuubo, may lagnat, yan po ay considered na po na health deficit. Now, others, ang problem po na nakikita natin has something to do with developmental aspect, no, in nature. So let's say they fail to thrive, like they are very small for their age. Okay? So, yung gano'n, like for example, severe malnutrition yung nakikita natin doon. That is also a health deficit. They fail to develop according to their normal rate. Delay ang kanilang development. That can be considered also as a health deficit. So kung merong family member na gano'n, ang kanyang condition, that could fall under health deficit. Now, kung meron din namang family member which has a disability, pwede po ang cause nito, it could be congenital in nature or it could be as a complication of illness. Whether that disability is transient or permanent, still we consider it as health deficit. Nakuha po ba? Now, if you are holding your copy sa inyong typology of nursing problems, okay, hindi po mahirap talaga kasi nandito na po sa list lahat-lahat. Halimbawa, alcohol drinking. Saan po napunta si alcohol drinking? Kunyari yung tatay palahubog, si nanay palahubog din. Okay, yun yung nakikita ninyo. Umiinom umaga pa. That's the problem. They drink too much. Sige daw, saan siya na-belong? Check nyo daw dyan.
Unhealthy lifestyle and personal habits.
Okay. So, di ba, kung i-categorize po natin ito under first level assessment, tama po, sabi mo, unhealthy personal habits, specifically alcohol drinking. As, is it a threat? Is it a deficit? Is it a wellness state? Or meron pang isa na i-discuss ako, yung ating presence of stress points or foreseeable crisis. Saan po siya na-belong? In your list. Anybody? Saan po siya na-belong?
Health threats po, ma'am.
Health threat po, ma'am.
Health threat po siya na-belong. So, yun po yung gagawin ninyo. All right, you identify now the problem of the family. Now, you categorize it whether it is wellness, threat, deficit, foreseeable crisis, or stress point. So, madali lang naman tingnan dito. Halimbawa, okay, pagpalagay natin, during the interview, you were asking about the dynamics of the family, the relationship of the family. So, halimbawa, extended family. May away, okay, yung anak at saka yung kanyang tatay. Okay, so hindi sila nagkikibuan. And then they are, the rest of the family members are also affected. So there is a conflict. So that would belong to, saan po siya? Interpersonal conflict between family members. Saan po siya na belong? O dito lang muna sa tatlo mamili. Check your typology.
Stress-provoking factors, specifically
Okay.
interpersonal conflicts between...
So pag-state mo niyan, stress-provoking factors, specifically interpersonal conflict between family members as health threat. So yun na yung health problem nyo po. Yan po yung sa first level assessment. So halimbawa naman, kunyari, ang nakita nyo doon na problem is, let's say for example, okay, one family member is suffering from tuberculosis. So how will you state it? Automatic na po, tuberculosis as health, ano man siya?
Deficit po, ma'am.
Deficit po. Okay, so health deficit po, pagkaganyan. So, automatic na po yan. Now, nakuha po ba ang ibig kong sabihin? Pag na-identify na ang problem, check your typology. First level. Okay, tingnan ninyo saan siya na-belong. Deficit po ba? Threat po ba? Okay, wellness ba? Stress points po ba? Okay, nandyan na po lahat. Well, we also have, like, for example, accident hazard. Hindi naman broken stairs, hindi pointed objects, hindi naman fire, fall hazard. So, ibang klaseng hazard ang nakikita ninyo. You can specify it. Accident hazard specifically. Okay, lagay ninyo dyan. Okay, as health threat. That's how you are going to formulate it. Nakuha po? Sige. Proceed tayo dito sa stress points, foreseeable crisis. So sa stress points, nakikita nyo naman siguro, may mga list din po tayo ng ating mga stress points or foreseeable crisis. These are anticipated periods of unusual demand on the individual or family in terms of adjustment in family resources. Like, for example, additional member, okay? So, to a family. Diba? These are anticipated periods that requires, okay, adjustment in the future. Halimbawa, madami na ang anak, nabuntis pa ulit, so may bagong member na naman sa family. Well, that could be what? You need to make the necessary adjustment in terms of the family resources that is needed, no, in order to sustain the need of that particular family member. Okay? So that's why we call it stress points or foreseeable crisis. So entrance at school, madami dito. Okay? Loss of job, for example. O halimbawa, okay, may ano na, may sinabihan na yung tatay that this is going to be your last month, no, to be working with a particular company. So matatanggal ka na sa trabaho. So loss of job, okay, in that particular situation could be considered as a stress point or a foreseeable crisis for the family. We know very well that, let's say, the family is very much dependent from the father. So in the event na mawala ng trabaho, well, kaya kinakailangan gawaan ng paraan kasi we were able to foresee ahead of time that that day comes, then definitely that will be a stress point to the family. That will be considered as a foreseeable crisis. Nakuha po ba, students? So madali lang po, 'di ba? Pagkasakit, kunyari sabihin fever, at paano i-state 'yan? May lagnat ang family member. Fever as
Health deficit.
health deficit po. So, halimbawa naman, inadequate food intake, both in quality and quantity. Ano po yan?
Faulty or unhealthful nutritional or eating habits.
Okay,
Or
specifically,
Inadequate food intake both in quality and quantity
as
health threat.
health threat. That's how you are going to formulate it. O halimbawa, inadequate footwear. How will you state it?
Healthy lifestyle.
Okay. Unhealthful personal habits or practices, specifically
Walking inadequate footwear po, ma'am.
as
Health threat.
Okay. So, ganyan po ang pagka-state natin. Nakuha po ba, students? Yan po yung health problem ng inyong family. So, nakita na ninyo, ay, eto ang problema. Accident hazard, specifically, fall hazard. Okay? So, as health threat. Yan po. Okay? So, that's the first level assessment. So, you were able to define already the health problem of the patient. But that's not, the family, but that's not enough because we still have the family nursing problem. Now, saan naman po itong second level assessment? So, sa second level assessment, still you can find it in your typology. Diba kanina, health problem ang in-identify natin that we try to categorize it. Now, for family nursing problem, you are going to check the second level assessment. So these are the problems encountered by the family in performing health tasks with a given health condition or problem. Okay, the family, as what I have said, they have tasks to do. Okay, now health tasks to do. So in order to maintain the wellness of the family members. However, they failed to do it. Now, we are going to identify what is the reason of the said failure to do it. Kaya, if you have noticed, sa second level assessment, it will start with the word inability. Nakuha ninyo, class? Inability to recognize the presence of the condition or problem due to, mamili ka na ngayon, lack or inadequate knowledge, lack of knowledge, or inadequate ba yung knowledge ng inyong family. Okay? So kaya like for example, pagpalagay natin, yung problem kanina is walking barefooted or inadequate footwear. Na nang iyang mga anak, yang bana, pati siya, nagtiniil lang. So, wala nagachinelas. Tapos, ang ilang, makita pa gid niyo ang immediate surrounding, pwerte kahugaw. Okay, na kanal, na adito'y mga mga poop dito, kay wapod sila CR, dito lang sila malibang sa gawa. So, nakikita niyo yung situation doon sa community, nakapaalang, tapos marumi, may mga sharp objects doon sa kanilang immediate environment. So, yan po siya, health threat po. So, sabi ninyo, unhealthful lifestyle and personal habits, practices specifically, walking barefooted or inadequate footwear as health threat. So, the next question is, they failed to do their task as a family to maintain wellness. Bakit hinayaan na nakapaa? Ano kaya yung reason for that failure? Now, you decide. Tingnan niyo dito sa second level assessment. Is it inability to recognize the presence of the condition or problem due to lack of knowledge? Yan na, kunyari, ang mama pag-interview, uy ka nang, ma'am, mangutana lang ni ma'am. Kanang nga nung ginapasagdan manimo ang mga bata nga nagatiniil. Diba, delikado man ni ma'am, wala baka kabaluan ni ma'am. Yamuingon ng mama, ay, naanad naman na sila. Di naman na, masamad ilang tiil, kay na tubuan naman nagkubal, sige naman gina silang tiniil. O kunyari, ganun ang sagot ng nanay. So, saan siya mag-fall ngayon? Is it inability to recognize the presence of the problem, inability to make decision, doon kayo ngayon mamimili. So, there are actually, how many? Ang choices ninyo, 4 po ang choices natin. Inability to recognize the presence of the condition or problem due to pwedeng denial about its existence, okay? Specifically, okay, butang na to, ma'am, kanang, sagda naman kay, mahal nung kay chinelas, ma'am, hindi ka afford, okay? Economic ba? Cost implication? Why pang palit kung chinelas mo nang tiniil ang mga bata? Okay? Or, kung sa pamanlain yung reason, wala sila kabalo na delikado ang tiniil, unsa ang consequences. So, dun po kayo ngayon mamimili. Okay? You can identify as many as you can for second level assessment. Okay? Pwede kayo magdagdag. Nakita namin inability to recognize. They cannot make decision. Inability to make decision with respect to taking appropriate health action due to why they cannot decide what to do. Sample lang. Kunyari, fear of consequences, specifically economic consequences. Pwede, di ba? So, depende po sa nag-gather ninyo na information, na data sa inyong family. What is the reason why they failed to perform their health task? That's why the health problem exists. Nakuha po ba, students? Yun po yung inyong second level assessment. This reflects the reason why the family failed to perform their task. That's why the health problem exists. Hello? Okay pa ba ta? Students? Hindi kayo sumagot. Ewan ko sa inyo.
Yes.
Daga na kayo nag-off-cam.
Oo, ma'am.
Nag-off-cam na sila, Ma'am
Oh,
Shari.
daga na kayo off-cam.
Na wala na muna mingaw na.
Wala na
Okay.
sila mga sarili.
Okay, lumilipad na ang kanilang mga isipan. Okay.
Yeah.
So, yan po ang gagawin natin, students, ha? O, halimbawa, kita nyo doon. Ano man ni sila na improper man ang ilang garbage disposal. Nanong dili man makasegregate. Why they cannot, let's say, dispose the garbage on time. Ang reason nila kay wala magoy masugo dari ma'am, busy kaayo ning tanan. Ha? So, walay masugo na yung mga bata, gahi kayong mga ulong ma'am, nya ako busy kaayo ko, ana mama muna, nagtapok na namong basura din ha. Amuan na lang na siya din hang gitapok sa daplin. Nya sunugon lang namo kung makahigayon mi, bawal baya magsunog-sunog, bawal magtapok. It also favors the what? That can serve as breeding sites, diba? It attracts mga pests and all na pwedeng magdala ng mga sakit. So kung gano'n ang reasoning nila na ay wala man gud mi amot sa among buhato nani nga wa man gud mi masugo ma'am ya di pagid regular diri ang okay. So unsa man na pwede sigurong ang second level assessment ang family nursing problem inability to make decisions with respect to appropriate in respect to taking appropriate health action, okay, due to, pili na pud ka din ani. Okay? So, unsa kaya ang reason? Okay? So, inaccessibility of appropriate resources, specifically, physical inaccessibility, unsa ba, or unsa ba di ang rason nila based on your interview. Okay? So, yan po ang gagawin natin for second level assessment. So, that's why stated here, so using your typology of nursing problems, we can already identify what is the health problem of the patient and categorize it by referring to the first level assessment in your typology. So, kung ang ating ipo-formulate po health problem, punta po tayo sa first level assessment. Kasi naka-list down po doon, naka-categorize po lahat ng mga problem. Now, if our aim is to determine the family nursing problem, punta po tayo doon sa second level assessment. Let us try to identify what is the reason why the family failed to perform their health tasks. So, ang first three will always start with the word inability. Yung pang-apat lang yata ang nakakaiba. Okay? Failure to utilize community health resources for healthcare due to, then you have to choose. Okay? So, yung first three starts with the word inability. Okay? Kasi health task man ito dapat. Recognizing, pag may sakit, kita na nanay sakit, wala gidala dito sa kuan, wala gidala dayon sa health center, giubo na og let's say duha ka bulan, gi-TB di ay. Okay, na TB na ang pasyente, wa man gidala nila dayon sa health center or any private clinic no kung ayaw nila sa health center. Bakit nangyari 'yon? Bakit lumala yung sitwasyon? Okay? So, pwede, inability to recognize the presence of the condition or problem due to, okay, denial about its existence or severity. Ano ba ang reason adto? Okay, as a result of fear of consequences of diagnosis of problems, specifically, wa nadala tungod kay, wala man gud mi kwarta ma'am, una ipasagdahan lang namo. Okay, so, due to, specifically, economic or cost implication. So, pwedeng ganyan po ang pagka-sulat po ninyo for family nursing problem. Sige. Now, ito yung example ko. Okay? Granting that these cues already are clustered and then we already identified that these cues are considered to be relevant. Okay? So, relevant ito lahat. Kaya, sinali namin ito. We group together all of those relevant data. Okay? So, sinulat namin, okay, part po siya ng cues. So, di ba, in the formulation of your NCP, you need to write down the date and time. Okay? And then, the cues. You should categorize it into two, subjective, objective. So, kagaya nito, mother verbalize. Dili man na makuha nila o maghatsing o magistorya ko, kay nagpa-test bitaw mitong ni Agi, negative man sila. When asked as to reason why her TB recurs, she replied, ambot nga ni, basig sa ako ang kahago, unya, sige kulaw magabi. As stated by the mother, mga alas 12 na mi pasado makatulog kay mangyawat pa mi paninda o barbecue sa gawas. When asked if she is taking her medication, she answered with a smile, kalimot ko usahay, tungod sa kabisi, lagi, why makakuha sa center. So, these are all subjective cues. Ang case nito, yung nanay nagkaroon ng relapse ng kanyang tuberculosis. Okay? So, yan po yung verbalization ng mother. Objective cues. Highest educational attainment of both husband and wife is grade 4. Diba? Based on the statement niya, parang alright, this can support talaga yung understanding nila pertaining to the disease process itself is kulang. Kasi nga naman, okay, grade 4, well, somehow, no, meron siyang impact, no, kaya ganun ang kanilang behavior. Now, wife had PTB year 2018 and was cured, but currently, wife is near positive again, categorized as relapse, no, according to the DOTS, the program. On medication under the DOTS program, with 2 adults and 4 children family members. So you see, may mga bata po na family members. These are the groups which are vulnerable, okay, for TB as well. Mga bata, Okay? Now, living in a multi-purpose room. So, ibig sabihin, yung pagpasok mo, yun na kaagad yung kanilang, yun na lahat. Okay? So, multi-purpose room po ito. So, you notice that there is overcrowding. The total floor area is only 10 square meters. Total space requirement is 12. O, kulang sila ng 2 square meters. So, there's overcrowding. And there is poor ventilation as well. So, these are the cues which can support the problem. So, ang nakikita, pwede rin ang problem ng mismo is PTB as health deficit, diba? But another problem na nakikita namin dito affecting the family would be threat for cross-infection or threat of cross-infection from a communicable disease, specifically PTB as a health threat. Alam naman natin na ang tuberculosis po is communicable. So, let's say for example, this is the health problem. Again, saan ko ito nakuha? Sa first level assessment. Okay? So, first level assessment po ito. So, that's how you are going to formulate your FNCP starting with the date and time, and then you have the cues. So, tingin-tingin tayo sa mga cues, huwag po kopyahin lahat. Pakyawon, like what I have said. Hala, naunsa naman yung student. Ipakyaw niya tanan. Balsi manggog na ako yung mamis, ma'am. Dili manikuan ha na ang CI pang mangita. Kani pwede ni kani dili. No. Ayun na po ang magtanggal ng mga irrelevant data. Only those relevant you think can support the problem that you have identified. Now, since you have already the health problem, diba ngayon, okay, there is a failure on the family to perform their health tasks, no? Bakit nagkasakit ulit? The same illness. TB na naman, nag-relapse ang TB. Bakit kaya? So, based dito sa mga verbalization ng nanay, okay, so we are going to identify what is the family nursing problem. Saan nga ulit titingnan ng family nursing problem? Miss Villaraza? Saan po natin makikita ang family nursing problem?
Ma'am,
Saan
Saan?
makikita ang family nursing problem? What's our
Sa-
reference?
sa typology po,
Particularly where? Saang level of assessment po?
sa first assessment po,
Sa first assessment ba?
first level of assessment po.
Sa first level of assessment? Sure? Isa pa ning nag-raise o banbe? Okay. Kita na ako diri. Ay, buti na ako kita. Okay, Miss Manggubat. Saan natin makita?
Second level assessment.
Sa second level. Okay? Once you have the health problem now, pagdating mo sa family nursing problem, yes, you use the typology, pero ang titingnan mo, second level assessment. Okay? You're going to analyze, uy, nganong naingon aning man? Okay? Nganong naman sila yung problem na ani? Okay? Why they failed to perform their health task? Ano yung reason? So, dito po, ayan na. Ang ating family nursing problem. So, inability to recognize the presence of a problem or condition due to, unang-una, wala siya kay balo sa hinungdan daw, ano nag-relapse, nagbalik yang kuan. Inadequate knowledge of the disease process, misconception, kay di ba ningon to kaganina na, so to yung statement kaganina, ingon ambot ngano ni basik sa ako kahagbo unya sige pulaw magabi. So this is really an indication na wala siyang alam. Okay, wrong din yung kanyang pagkakaintindi. Okay? Then ano pa? Pwede rin tayo magdagdag pa ng additional family nursing problem because this is not just basically limited into one. So kung meron pa tayong nakikitang reason why the family failed to perform their task, then we can add on. Ito pa yung isa. Inability to make decision with respect to taking appropriate health action due to failure to comprehend the nature or magnitude of the problem. Diba? Dapat mag-comply siya ng kanyang medication. Dito sa statement niya, when asked if she is taking her medication, she answered with a smile. Halimot ko sahay tungod sa kabisi lagi, why makakuha sa center. Okay. So kumbaga, hindi niya siniseryoso yung nature ng kanyang problema, the magnitude of the problem. Okay? Hindi po ito nakikita, no? So, the family failed to comprehend na pag hindi tayo nag-comply ng medication, pwede siya magka-drug resistance, no? With that particular medication. So, lisod na noon tayo ma-cure ang iyahang tuberculosis. So, yun po yung nakikita natin na family nursing problem. Okay? Nakuha niyo po, class, na sundan ninyo from the data collection, data analysis, and then problem definition. We will start with first level assessment for our health problem, second level assessment for our family nursing problem. Okay? Now, what's the next step? We are going to formulate our goal of care. Okay, balikan ko lang yan siya later. Ayan. So, anong pinagkaiba? I think paulit-ulit na tayo nito sa goal. You know this. When we say goal of care, it's a general statement of the condition or state to be brought about by specific course of action. Example, to improve nutrition status of the family. So, napaka-broad po nung statement natin. Pag sinabi nating goal, this is the overall, okay, action, okay, that the family has to achieve at the end of the intervention. So, generally speaking, anong gusto nating mangyari pagkatapos ng intervention? Anong mangyayari sa family? Now, goals must be set jointly with the family. Siyempre, no? For them to participate, remember that this goal, these objectives, this will serve as our basis for determining what will be our interventions. Now, if it is not mutually set together with the family, most likely the interventions that we are going to suggest, they will no longer follow it or they will not cooperate with the suggested interventions. So, dapat mutually set with the family. Objectives refers to a more specific statement of the desired results or outcomes of care. The more specific the objective, the easier is the evaluation of their attainment. So, yan yung kaibahan ng dalawa. Mas specific po ang objective. Okay? So, that's why sabi kanina, you have to use behavioral terms for this one. It should be smart pag sinabi nating objectives compared to our goal. Sige, going back to the example that we have, ito po yung goal natin. After nursing intervention, the family will develop awareness and understanding about measures to take to avoid transmission of PTB to other members of the family. Okay? Hindi naman to. Develop awareness and understanding. Napaka-broad po ng statement na ito. Therefore, we need to write our objective of care. So here, very specific po tayo. Meron tayong time frame. After an hour of nursing intervention, the family will be able to A. State briefly the cause and mode of transmission of PTB. Enumerate at least 5 ways to prevent possible transmission. C. Decide on preventive measures to take. Ito po yung ating objective of care. So lahat po ito pwede nating i-evaluate. State. Okay, they can verbalize, no? So if they understand what's the cause, what's the mode of transmission. Yes, Mr. Hestosani?
Yes po, ma'am. Good afternoon. I just want to clarify something on the objective of care. It was stated po kasi kanina na it should have at least one cognitive, one affective, and one psychomotor. As I am scanning through the objective of care, I am seeing 2 cognitive
Yes.
objectives and 1 affective, which is the decision. With this po, ma'am, is it okay na wala si psychomotor for our objective of care?
Okay lang naman po, not necessarily na present po yung talagang cognitive, affective, and psychomotor. Usually, ang mga psychomotor kasi, if they will be return demonstrating, tapos makita mo naman dito ang time frame natin after an hour, tsaka ang goal of care lang naman natin is for them to develop awareness and understanding. So, okay lang po siya, sir. Okay.
Thank you so much, ma'am.
Okay. Naku ha, nag-o-observe talaga si Mr. Hestosani. Sinabi ko talagang cognitive, affective, psychomotor. So, he's listening talaga. So, na-analyze state. Okay, if you can state knowledge. Enumerate, okay, knowledge. If you can decide, it's more on the affective aspect. All right, very good. So, yan po yung ating objective of care. Okay, so tapos na tayo. May goal of care, objective of care. Now, if this is our objective of care, this is the goal of care, then we need to address this one by trying to come up with interventions that will help the family achieve what was stated in our objective of care. Kaya, eto na ngayon ang interventions natin. Okay, so these are the set of interventions that I have right here. So, sabi natin, the interventions does not require rationale. However, you need to be very specific. So, this one, pwedeng ganito, provide the basic information regarding PTB. Kasi kung ganyan lang na statement, very broad siya. So, what about? What basic information? Like the causative agent, mode of transmission, what are the risk factors, main signs and symptoms. Okay, specify pag yun, 2 weeks or more na cough, and explain like that. So, kompleto po. Next, elaborate further the different ways on how airborne transmission of mycobacterium is possible, like sneezing, coughing, talking. Third, discuss the ways of preventing the disease transmission, such as isolation, keeping distance when talking, wearing mask, proper disposal of used tissue and face mask, covering mouth when sneezing or coughing, proper hand washing, use of alcohol or hand sanitizer. Number 4, emphasize practices that will enhance the immune system, like adequacy of rest and sleep. Kay, di ba, na-emphasize ka ganina, sige lang daw sila o panmaligya o barbecue. Eating nutritious food, intake of vitamins. Then the 5th one, discuss the importance of treatment compliance, like strict compliance to the treatment for the first 2 weeks will make the patient no longer highly communicable. Or maybe you can add on pa. Now, eto yung set of interventions natin. So your interventions, kailangan naka-prioritize na po siya because kung ano yung number 1, that's your first priority. This is different from the individual NCP na maglalagay kayo ng number with the implemented interventions. Ito, naka-arrange na po siya talaga sequentially on how you were going to implement this to your family. Nakuha po? Now, method of nurse-family contact. So here we have home visit. Sige, puntahan natin. So that's the method of nurse-family contact. We have home visit. Meron pa ba ako dito? Objectives. So ito, example lang muna ha, sa goal of care. The family will develop appropriate actions to maintain family size based on a sense of responsibility for love and life. Napaka-broad. Pero dito, objective of care specific po talaga. At the end of the first home visit, the family will be able to explain comprehensively what family planning is all about, enumerate at least 3 ways of maintaining the size of the family, and the last one, select one family planning method most appropriate for them. So ito, klaro talaga, no? Objective of care natin. Napaka-smart na po ng ating statement of our objective of care. Well, this one, sometimes daw you'll have failure in setting goals, no? When you set it together with your family. Okay, there are some barriers that you need somehow to explain, no, sa ating family because they failed to perceive the problem. For them, it's not a problem. It's you who only see it as a problem. Realize the problem but too busy at the moment. So, do not see the problem as serious enough to be solved. Kaya nga, meron tayo dun sa prioritization, kapag ang perception niya sa problem is napakababa, okay, they don't see it as a problem, mababa rin ang score. It does affect the priority. So, hindi siya priority problem. Mababa ang score eh. Hindi receptive ang family kapag ganito. Okay? That's why we need to do prioritization because we cannot address everything, all the 10 problems. Okay? The family may perceive the presence of the problem and they need to take action. However, they refuse to face and do something for the following reasons. So sometimes they're afraid of the consequences. It is against their tradition. They fail to perceive the benefits. They fail to relate actions with family's goal. Ibang gusto nila, ibang gusto natin. Or failure to develop working relationship from both nurses and family. So if you will be setting goals, see to it that you have already established good working relationship. Kasi kung may isasuggest ka, ganito sana gagawin natin. Ma'am, nangyari po talaga sa community na ang bahay nila napakaliit. There is inadequacy of living space. Now, what the student suggested to the family is i-rearrange po yung kanilang multi-purpose room. Talagang nagtanggal ng mga gamit at nag-arrange po talaga yung mga student. Okay? At pumayag naman, hinayaan naman yung mga estudyante, hinayaan naman kami na parang nag-makeover kami doon sa kanilang multi-purpose room. And nangyari talaga. What if kung ayaw ng family? Ay, ayaw lang, dili lang na ilabay, dili lang natanggalon, pasagdi lang na din ha. Okay. So, of course, they also have the right to refuse, no? But then somehow we have to explain. Okay? So, ano magiging benefit nito kung gagawin natin? Okay? Anong tulong nito sa kanilang health? Pero nangyari na po talaga na nagligpit talaga kami. Okay? Gi-arrange na mo ilang balay, Ma'am Arsenio, gi-makeover na mo, gi-arrange yun properly sa student. So medyo dugay jud mino kay nanilhig pa, gipangtanggal tong mga people sometimes even if they don't need those stuff, hala, sige og kanang imbak ana sa balay. So, yun. Pero ano naman sila, receptive naman. Maganda naman yung working relationship ng student nurses at saka ng family. So, at the end, natuwa naman sila. Naging maganda na yung kanilang bahay kasi ni-makeover ng mga students. Well, anyway, eto lang. Siguro, i-discuss naman sa inyo ito. Developing the intervention plan. Wala po kasi kagaya ng mga book sa individual NCP that there is a set of interventions that you can choose. Diba, meron tayo niyan if you are going to make your individual NCP. Dito naman kasi, wala namang book talaga na all right, these are the set of interventions that you have to do for this kind of health problem, family nursing problem. You can use several resources, no? Practical magudgayo niya atong mga intervention. So you just need to remember what will be the focus of your intervention to help the family perform the health task. Unang-una, you should help them recognize the problem. Kasi yung kadalasan na reason why the problem, inability to recognize the problem. So let them recognize the problem by doing what? You have to give information to them, increasing the family's knowledge on the nature of the problem, magnitude, and cause of the problem. Kaya very common yung discuss with the family, ganyan-ganyan. Okay? Teach the family. Ano pa bang word dyan? So, usually, yun yung ating mga statement, no, in our intervention. Okay? So, we need to increase their knowledge because they don't recognize it as a problem. They don't understand the magnitude, the gravity of the consequences, no, kung wala tayong gagawin. Now, helping the family see the implications, diba? Discuss rin. What are the consequences of their action? Like, okay, kung nakapaalam po ang anak at ang mga iba pang mga family members, so what are the consequences of their action? So we have to discuss, present to the family the consequences of walking barefooted, such as letter A, letter B, letter C. Yan. Pwedeng ganun ang pagka-state ng inyong intervention. Letter C, encouraging positive or wholesome emotional attitude towards the problem by affirming the family's capabilities, qualities, resources, and providing information on available options. So, very common is we provide them options on what to do. Okay? Now, provide the family with options regarding, let's say, preparation of, let's say, a menu for breakfast. O, halimbawa, so magbigay ka ng options doon, letter A, letter B, letter C. So, things like that. Okay? So, actually, sabi mo ba, parang i-encourage mo doon sa inyong conversation, we appreciated, no, that you prepare breakfast for the children. So, however, we need to provide you some other options, no, para mas lalo pang ganahan kumain ng mga anak mo at mabalance po yung pagkain na ibibigay ninyo sa family ninyo. So, these are the options po. So, things like that, no? So, pwedeng ganun po ang interventions natin. Now, guide the family on how to decide on appropriate health action. Kasi minsan, it's guidance, no? Ang problem. I mean, decision-making. Inability to make decision on what health actions to take. So, libog sila, unsay lang buhaton. Okay? Like, there was this one case na nabuntis ang anak, tapos bata pa kaayo. Walay mukuyog sa iya sa health center. Kay maulaw sila na mukuyog sa iyaha. Okay? Kay unsa na lang daw ikasulti sa mga silingan na ang anak, bata pa kaayo niya, buntis. So, dili nila ginakuyugan. Wala nagpa-prenatal check-up o niya. ang hemoglobin sa pasyente or sa family member na buntis kay ubos kaayo. Ang edad niya kay is only 14 years old. So, yung mga ganon. So, you have to guide the family on how to decide on taking appropriate health actions. So, letter A, identifying or exploring with the family the courses of action available and the resources needed. So, pwede. So, explore with the family their understanding regarding the present situation. By, sa man yung buhaton. Now, discuss the consequences of the course of action available. So, like, kagaya nun, kung hindi nila sasamahan, so what will be the possible consequences of such action not bringing their family member for prenatal checkup to the health center? Analyzing with the family the consequences of inaction. So yun na nga, if they will not do anything about it, now what will happen? Next, develop the family's ability and commitment to provide nursing care to its members. Like for example, under here, you have demonstration, practice sessions, and procedures. So, eto na ngayon. Minsan, it's not enough lang po na puro statement, verbalization lang tayo. There are really problems, no, existing or health problem within the family that requires ability. They must show commitment that they have to do it. That's why we let them demonstrate, okay, certain techniques, okay. Now, demonstration, practice sessions and procedures, treatments or techniques utilizing readily available low-cost materials and equipment and other resources. So yan po, pinapa-return demonstrate. So ito na yung sinasabi kanina ni Sir na nasa anong domain na ito? Psychomotor na po talaga. Then, enhance the capability of the family to provide a home environment conducive to health maintenance and personal development. Okay? Because they failed to provide a home environment conducive to health and maintenance. So, ito very common problem. Home and environment po talaga. Then, facilitate the family's capability to utilize community resources because sometimes hindi nila alam na meron palang ganong klaseng facilities within their community. They do not know where to go. Okay? So, tuturuan natin sila. Okay? We have to inform the family of the possible available community resources within their vicinity. Okay? That can provide them assistance in terms of, let's say, for example, unsa man. So, butangin mo dito tanan, sulat ni mo dito tanan. Okay? So, yun po yung ating guide when we are going to formulate our interventions. So, again, depende na po kung ano yung health problem, ano yung family nursing problem. Now, for the type of nurse-family contact, we can have clinic or office conference. Like, in our case, siguro, that's clinic conference na. Kasi kung pupunta sila doon, mismo, and that we are going also to obtain all the necessary data, well, this could be our type of nurse-family contact. It could be clinic conference with the pregnant family member. Okay, you can have telephone conference as well. Like, ang problema lang dito, baka walang load si pasyente, di kayo nang tatawag o okay lang sa kanya, hingiin niyo yung cellphone number niya, anong oras siya pwedeng matawagan, or mag-video chat kayo, Randy, ng iyong family, kung merong internet or what. Kung yari may nakula kayo pwede niyo ba siyang So pwede, video chat na lang kayo, that's your type of telephone conference, or mag-video call conference kayo ng iyong family. Well, that could be possible right now, no? Because we have a very limited hours, no, of contact. Now, etong mga written communication, eto na siya kapag mga grupo na po yung ating ikakandak na assessment, no? It's not only one family. This is applicable, like for example, if you will have your co-par, we need to have a written communication for them to be gathered all together in one place. And then yun na, magkakandak tayo ng survey or interview ba? O, pwedeng gawin natin ito. Pero ang pinaka-common po talaga, itong home visit. So, home visitation. So, ito yung gagawin natin. So, we visit the family and then we are going to conduct the interview. We do our implementation, evaluation during the home visit. So, that's our, kumbaga, that's how we establish relationship with the family in the process of implementing those interventions. Now, we can have also group approach. Naman na yung ginatawag ka ng health classes. Kung only a few, like for example, group of elderlies. Okay, group approach na siya. So, pwede rin kayo, yun ang inyong method of nurse-family contact. That's how you are going to carry out all of those interventions. So, kanisya, pang na ninyo ni, kanang mga co-par. It could be the entire community, entire barangay, no? or it could be selected lang, depende po sa recipient ng inyong health classes. Noon, nagkakandak sa panahon namin, uso itong mother's class. Mga nanay lang. Okay? So yun po, doon po ginagather all together sa isang lugar, may sa chapel, yun. And then we are going to conduct our implementation. That is our nurse family contact with the group. Okay? Pero tayo, siguro telephone conference, home visit, yan. So, yan. For the resources that you will be needing, you can specify, pwede mga materials, what supplies you will be needing for the implementation. If you need equipment, teaching aid kits, visual materials, handouts, charts, ganyan. Now, for human, other than the healthy members, development workers, community leaders, so sometimes we need to collaborate din kasi kung kinakailangan, no? So, if we need to collaborate with other groups, pero pwede rin naman tayo na mismo. Our time, our effort, yan. Part na yan ng resources. Tayo mismo, student nurses. Okay, human resources na rin yun. Okay? Ano pa ba? Lastly, is your evaluation. Evaluation is a distinct process. It is related with and primarily based on objectives of nursing care. So, evaluation is comparing what actually is with and what should be. So I think alam niyo naman ito sa individual NCP. When we are going to evaluate, we always need to go back to our previously set objective of care. Okay? Titingnan natin doon na achieve ba po natin or hindi. Okay? So what should be achieved and what is actually existing as of the moment. Okay? Anong nangyari? After an hour, nagawa nga ba ng family natin? Sige, balikan natin ha. I-kompleto natin yung kanina. So, I already mentioned about the interventions. Method of nurse-family contact, it's home visit. Okay? Yan po. So, these are the different resources. Okay? Resources required for the implementation of this particular set of interventions. So, human resources. So, ito na, time and effort, both of the student nurse and the family. Knowledge and skills of the student nurse. Yan, human resources yan. Material resources. So, kunyari, nag-prepare kayo ng PowerPoint, presentation, your laptop, meron kayong video clip, yun, yung mga materials din. Or, kung ano ba, may mga flip chart ba kayo? Ano bang pwede ninyong ibigay na mga learning materials, no, for the students. So last time I got really amazed. Panahon pa nila ni yung nag-graduate pala, yun yung last ko na na-handle ng community na face-to-face kami. They're so innovative, they're so creative, no? Ang ilang mga materials, nag-create yun silang bitaw mura o saan nang tawag, murag booklet, no? Wherein they give it to the mother and then nandoon lahat ng kanilang health education. So, nobody told them to do that. So, parang na-impress naman ako, like, kuyawa, ni mga bataan, nag-create man din sila aning booklet. So, nung unang panahon, ang mga dala lang talaga namin, mga material resources, mga chart lang, mga bitay-bitay max lang tayo, yellow paper, yan, sinusulat na namin. Pero ngayon, we need to make use of technology. It's more amazing if they will see it, they can appreciate it better. Diba, naka-video clip na, pakita ninyo sana ng ang blood flow, let's say for example, hypertensive ang family member, ganyan. So anong mangyayari, the risk for stroke, things like that, no? So para nakikita talaga nila. Ingon ani ang may tabo. Then you have to pause and then you discuss na naman with the family. The next would be financial resources. So syempre, pera kailangan natin for our fare going to the community. Now, if you will be purchasing something, okay, you need money for that. So, halimbawa, yung sabi ni Ma'am Fuentes, ang nakita ninyo, ang problem doon is improper garbage disposal. So, you actually decided to incorporate in your implementation the purchase or the giving of garbage bin. Okay? Or sako na lang yun. So, ma-surprise pa ka na, ang sako, dili gamiton. Ernest, kay sayang daw. Asang sako, ma'am? Pag-evaluate, ay ma'am, wala na mo gigamit kay gwapo, manggod. Amuha lang siyang buhaton og trapal. Hala. So, wala. Nag-serve ang purpose sa sako nga buhatan og basurahan. Malata o dili malata. So, wala na. Kay lahi ang gigamitan sa sako. Okay, ay ma'am, gibuhat na mo siyang banig, ma'am, sa amo ang floor. Kay sayang, manggod, limpyo. Naka na siya. But then you have to write it down also. Kung ano yung mga binili ninyo. Okay, purchase of ganyan, kailangan ninyong financial. Okay? Or any other resources na kakailanganin ninyo in the process of implementing the interventions. Okay? You have to write it down here. Okay? Next, punta na tayo sa evaluation natin. So, sa evaluation, what is being required, same as your individual NCP. You need to write the date and the time as well. Okay? Then, you have your general conclusion. Goal met ba? Partially met ba? Not met po ba? Halimbawa, ito, goal met. After an hour of nursing interventions, the family stated, di ba, kailangan mo yung state, kagaw gyud di ay ang hinungdan sa TB ug ang kahago dili mao ang direktang hinungdan nga TB-hon ang usa ka tawo ug kini makatakod sa uban pinaagi sa paghanggap sa hangin nga dunay kagaw gikan sa pag-ubo ug paghatching. O syaro, kritika kompleto sa statement, di ba? When asked to enumerate the preventive measures against TB, the mother replied, sa akong mahinumduman, kani ang mga pamaagi na malikayan sa akong pamilya na matakdan sa TB. Una, sampungan ang baba o mag-ubo o maghatsing. Dili magpaduol o magstorya sa mga kauban sa balay. Ilabay og sakto ang tisyo nga dunay luwa. Manghugas gyud permanente sa kamot o magsuot og face mask. When asked which of the preventive measures they decided to follow, wala ko. The mother replied, basta na siya reply din ani, hindi na ako maklaro ang iyang response. So, meron po talaga siyang corresponding proof. Nakuha po ninyo? So, that's how you are going to evaluate. So, kung ganyan ka ba naman mag-evaluate at hindi mo lang ni past tense, okay, eh di wala na tayong problema dyan, right? Kasi nandyan ang proof, ano pang itatanong ko, nandyan na. Kaya nga lang, wala tayong opportunity to evaluate. Pero kung ganito, 1 hour after, we can evaluate this type of in the objective of care that we have stated. Kasi lang ito, health education, more on knowledge, developing awareness. So pag humani mo explain, you can immediately ask. So ma'am, mangutana lang ko ma'am ha. Unsa gani ito hinungdan ma'am, nganong tibihon ma'am? Kung dali ra kaayo ninyo siya i-evaluate. Kuha, students. Mga moms, nahuman ako sa FNCP. Do you have any add-ons before ako mag-move on sa next? Ito, sample lang ito. Punta na tayo sa prioritization of problems after this one. Questions so far before we move on?
Wait, ma'am.
Yes, Mr.
Ma'am Jack. Nag-question diri.
Yes,
Pwede ba damata ko candy sa mga bata or any food?
candy, yun. Yanong candy man inyong ihat. Ayaw lang po ng candy siguro. Kana po something nutritious, pan na lang siguro or biscuit. Ayaw naman candy.
Biscuit.
We are allowed to give basta yung sealed gani na sa grocery na wala gani siya way na expose ang food, like kung mapalit kag pansit mura mago siya wata kabalo, although kabalo ka bagong palit pero basig madao tog kwan, unlike yung galing sa grocery na sealed siya, mas safe time mo bigay nun, dili ta mapasangin nila, basta sure lang ta dili expired tong gihatag, no? Biscuit na mga kuan.
Correct.
Pwede siguro yung ganun.
Kanang pwede gyud na siya natong hatag namang iba na luoy gyud gani kaayo, like other than usahay po mo palit man ta kanang in relation to our intervention, balik kagaya ng mga basurahan, ganyan, magbili tayo ng ganyan, or let's say for example pagkaon, like for example gulay ba, prutas pa, ana mong ginahatag sa ilaha. Pero or kung ang problem po nila is kanang hygiene nila, why toothbrush, why chinelas, mga anak, palitag toothbrush, toothpaste, sabon, ingon anak among ginahatag sa ilaha. So related lang gihapon sa identified na health problem. Okay? Pero kanang mga dinagko na like kuyaw na pud kay na mga electric fan, wala mi nagahatag na too much na pud na kay.
Kanang o kana pong yung bitbito kung pwede ka na ganing matago, dili ka na i-display, kanang discreet lang paghatag sa family kay
Correct.
kung kayo mo gipangbitbit dala mo dako kay box dito nya mo balantra mo paso dito, di ba daghan kay mo fans club ana, kanang please lang ha, dili ta mag-attract og mga katawhan because
okay, napa jud tay one
Santa
time na
Claus.
naghatag gud mi unya kay silingan lang man ang kuan, silingan lang ang mga buntis ba. Unya kay ang isa ka grupo bongga-bongga pud tong mga nagdalag cake, nag-ana-ana. Pag abot to speakers, ang gidala kay sako lang. So ni ana man tumon hala, sako lang gyatag sa to. Oh my God. Sako sa mukha. Uy, compare. Noon.
Oh, ang gastos daw saan galing? Sariling
Sa
pocket
inyo.
ninyo. Kaya anuhin ninyo, pag-isipan nyo ng maayos, ano yun. Kasi in the first place, hindi nyo pera yan, pera ng parents nyo yan. Ha? So you have to think about it very well kung haon ba siya, if it fits the patient's need, no? Will it address the patient need? At saka, hindi siya yung basta gagastos lang kayo ng gagastos. Anyway, rich kid bitaw si rich kid bitaw na akong mga kauban, mga kuan ako, mga mayaman sa papa, ayaw mo mag-ana ha, kay dili siya maayo na practice. We don't want them to become dependent, but we just want to initiate,
Yes.
masugdan lang ba para ma-address ang ilang problem, makatabang ta in a way.
Correct. Masig adto na mo sa inyong grocery dito sa balay, yung mga nga dilata dito may pangkuha na.
Purot pagkaon sa balay.
Kuyawag mga hati, mga spam, mga ana, marami man yan sa bahay, ma'am. Hala ka. Sabuan yun sa yung mama. So, yun. Like, yun ang gagawin natin. Pero definitely, nagid may token. Diba, kayo marag ma-istorbo, magudato po sila, tugay kaya itong interview, nagid bi anay something for them. Na malipay sad sila. Okay? Pero tama-tama lang po. Huwag naman yung sobra-sobra. Sa lang question mga ma'am, na pa ba?
Ma'am, will we
Yes.
allow the student to bring laptop for the resources?
Laptop, ma'am?
Yes po, laptop.
Pwede.
Pwede kung ano.
Siguro isa lang sa isang
Oh,
session
isa lang.
no?
Oo,
Pero
oo.
ha, taguan ninyo ha, ayaw mong display dito ha, kay Diyos ko Lord. Dili tayo as much
Oo.
possible na mga valuables na yung as much possible ginapa-avoid namin para walang ano. Like for example, it's better to give them like mga yung handouts na yung mga katulad yung mga ginagawa ninyo because you can leave it to them. Pwede lang balik-balikan. But for the laptop man good, murag kuan man good no kanang humagtan-aw murag sa tarong TV pagka nakalimot na sila, uli na kasi pwede mo ibili ng laptop after. Mas maitong something, any material na mabili nila, balik-balikan nila after. Meron ano ba? Oh, ma-browse pa nila balik. So far, that would be better than yung gadget na ano kasi hindi man maiwan sa kanila. Sis Tosani is raising his hand.
Yes, po,
Yes.
ma'am. Good afternoon po, teachers. It is still in line with the resources po, ma'am. You mentioned earlier po kasi na if we have connections, if namin mapangitaan o kanang resources like instructional materials, pwede ra po ni mga yo. Can we do that during our CHN pod, ma'am, if we have connections, outside
Yes.
connections?
Yes. If you can use that as a material, no, that you don't have to spend for it, that would be better. And you can leave that to the family, but that they can make use of it even after where we leave them, no, na humana ta sa atong mga parts sa ilaha, but they have something na pwede lang balik-balikan. At the same time, syempre, that I think that's prepared for them by whether it's a government agency na pinagkunan mo ng source na yan, then I think that's really that would best fit no sa kanila kasi that is designed for them, di naman designed sa mga sa ibang mga tao. That's mostly for the community.
Ma'am, thank you so much, ma'am.
Welcome.
Okay. So, move on na ba tayo? Okay na tayo sa FNCP. Anyway, uulitin ulit yan sa lecture. Okay, kung meron pa kayong hindi pa
There's
na-gets
another
doon,
question here, Ma'am Jack. Pwede po mag-video ma'am, no, or pictures? The answer is no. Picture taking, remember ganing Data Privacy Act? Lalo na pag that involves the patient, pagkuha ka ng pictures, just be very careful na hindi kasali yung because baka ma-question tayo yan for Data Privacy Act. Anything that involves the family, tapos magpo-post kayo. Hindi, even in our manuscript, talagang as much as possible, no pictures of the patient. Kaya nga nilagay natin si patient X, si patient ganun. Diba? We don't even put the full name there because if somebody gets hold of that paper that we have produced, they will get an idea. What if there are sensitive informations there? no? Na si wife nagkagonorrhea, nagkakuan, o di delikado masyado mabasa ng ibang mga ano, ginamit pambalot ng mga pagtinda-tinda later on kaya nabaligya si manuscript, yung mga ganyan ba. So, Data Privacy Act, the answer is no.
Tayo, pwede tayo mag-take ng photo. Like for example, for, di ba, anak man tanong, rotation, picture
Okay,
ta dito na. Nakabutang yun dito, Piapi Health Center. Pwede ta na. Pero with the
Kita.
patient.
Ayaw, not with the patient. Kita, okay ra dito. Pero ayaw mo, undangin mi ninyo ha. Kadang, ma'am, pa-picture ta, ma'am. Ma'am, please lang ha. Undangin na ninyo. Ayaw, may kapila-pila sa picture din na.
Noon, napaka-enjoy ng mga bata kasi we have the chance to go down dito lapit sa may dagat. Mga
Yes.
ana ba? Showcase na nila ilang mga payong, dalagin silang CHN bag, mag karon kay limited dili doon ta pataka og suroy. So dili ta dito magkuan-kuan.
Yes.
Pwede sa health center lang. Yan. Enjoy man ni community. Unta kung kuan.
Kundi lang kuan lami kay kabalo ka kada mo pait mong maruya dito. It's a very mo na mong pirmi ko adog. Actually makatambok sa community. Kay sige may kaon yung mga maruya, no, sige lang palit sa bakery og tinapay, mo na mong trabaho dito, no. Pero sa karon, as much as possible di mo maghabwa sa inyong mga mask kay mahirap na. Okay.
Correct. Sige, so okay na tayo dun sa FNCP. Kung anything pa, may clarify kayo. So with your respective CI and in your lecture as well. Kay lecture man po na siya balik sa inyo ha. So ito lang sa inyo ngayon, medyo mahaba kasi nga hindi pa na-cover lahat. Pero we are expecting next route nito kung community kami, wala na. Sitting pretty na kami nila Ma'am Puentes, Ma'am Igrinio, kay kabalo naman sila. So karon lang kay medyo alanganin mo, that's why sa manita asa po dani ni Ma'am nag-lecture naman ni si Ma'am. Okay, let's move on to priority setting. So kanina, sabi ko, you are supposed to identify 10 problems. Okay? So from the level 1 assessment, identify na mo 10 kabuok problem. But that 10 problems, kailangan ko munang i-prioritize ito. Okay? Kasi nga sabi natin kanina, we can only, we will prioritize only the top 5 problems no, for our FNCP. So may priority number 1, 2, 3 hanggang 10 po ito. Now, how are we going to go about it? Now, if you have already your identified health problem, we are going to prioritize it based on the following criteria. Okay. Now, what's the first criteria? The first one is you need to identify what is the nature of the problem. Anong category ng health problem mo? Wellness state ba? Health deficit? Pasensya na ha, nag-abbreviate ko diha. Health, siyang HX, dili na siya official. Health deficit, health threat ba? Stress points or foreseeable crisis. Later, you will see there is a corresponding scale for every criteria and for every choices. Another criteria would be modifiability of the problem. When you say modifiable, meaning we can change ba the problem. Probability of success in enhancing the wellness state, yung sabi ko kanina. So if what we see only is a potential, can we improve it para maging readiness na talaga, no? So can we enhance it further? Pwede pa ba? Then, or can we improve the condition? Can we minimize the problem? Can we alleviate it or totally eradicate the problem? So yan po yung focus ng ating modifiability. Then later on, may choices tayo. Okay? Easily modifiable lang ba? Partially modifiable lang ba? Or not modifiable at all. Now, to help us in determining the score or the scale, isa kaya ni easily ba ni partially ba ni ay dili na gid siya ma-modify ang problem. Now, we have factors to consider in determining the modifiability of the problem. Unang-una, may current knowledge po ba? Okay? Ang family pertaining to the problem, for the technology that is existing, what are the possible interventions? May alam ba sila? Okay? Yun ang tatanungin natin. Now, are there any resources that is available, okay, within the family? Like for example, accident hazard, fall hazard. Ang ilang hagdanan kay kuan na kayo, gabok na kaayo. The question is, Can we modify the problem? All right, let's check. Alam naman nila na gabok, no? Or hindi na talaga sturdy yung kanilang alam nila anong dapat gawain. Ang tanong, may resources ba? Eh, syempre, kailangan natin bumili ng kahoy, pako. Kailangan magbayad ng karpintero. Sabihin na lang natin, karpintero si tatay. All right, resources of the family, manpower, meron. Kaya lang, pera, meron ba? 'Di ba? So, yun yung mga tinitingnan natin, no? For us to modify the problem. Tayo, nurses, what resources do we have? Na nga tuwa jud kay health education lang gining amua. Mo lang gid among resources. Okay? Now, what about the community? May resources ba? Meron ba tayong mahingian ng tulong? May mga organizations ba that is existing that can help us? So, titingnan po natin. And from there, we are going to decide, can we modify the problem? Yes. Is it easily modifiable? Partially modifiable? Or lalisod na jud siya i-modify, ma'am. We cannot do anything about it. It's not modifiable. Then we decide for the score. Okay? So please take note of these factors. This can help you a lot when you are going to decide for the scale of your modifiability. Now, the next criteria would be preventive potential. Nature or magnitude of the future problems that can be minimized or totally prevented if intervention is done. Ang tanong, di ba, kapag halimbawa, yung sinabi ko kanina, threat of cross-infection, particularly PTB, okay? Pwedeng magkahawaan, no? If they will not do anything about it. But then, what if may magawa tayo? Okay, resources are available within the community. We have the health center. They can go there for early, let's say, diagnosis, no? They can undergo a sputum examination that is for free. Tapos pwede silang maka-avail ng mga gamot. At resources of the family, pwede naman taga sila makagawa. Sundin nila yung mga different preventive measures, right? So, nagbigay rin tayo ng teaching sa kanila. So, may magagawa talaga. Now, kung magawa natin ito, can we prevent the said threat of cross-infection from happening? You decide. Okay? So, anong score na ibibigay natin? Now, for you to be guided with the scoring, may mga factors din that can affect the preventive potential. Gravity or severity of the problem. Halimbawa, ang problem is smoking. Di ba? Health threat man yung smoking. So, kunyari, ang tatay nanigarilyo. Okay, let's say, how severe? Okay, like in one day, pila man ang mahurot ni tatay o ni nanay kung manigarilyo sila. Ma'am, minus kagyud gay ng 2 packs a day. O can you imagine? So, 2 pack daw ang nauubos. Tapos, ang isa ka anak, ilang eldest son, nagsugod-sugod na po ng panigarilyo. Makahurot na po siyang 3 sticks a day. Now, duration of the problem. Kung si tatay i-base natin siyang nauna, since what age po siya nanigarilyo? Ay, dugay na kaayo, ma'am. Mga kuan pa akong edad ani, ma'am. Mga 12 pa ko, o 12 pa daw, nanigarilyo na siya. Duration of the problem. Current management, meron bang ginagawa ang family para ma-stop yung paninigarilyo at ma-expose sila sa second-hand smoke and all? Wala. Now, exposure of high-risk group. Kisang high-risk group, extended family, na ay elderly, napagibuntis karon, napadjud sila yung mga bata. Daghan kaayong high-risk group dito present. Therefore, ang imong preventive potential, magbaba yan siya. Okay? So, these are the factors that you have to look into pagka nag-analyze ka na with the preventive potential. Okay? Kasi magja-justify ka kung mababa ang score mo, bakit yan ang score? Mababa ang preventive potential natin. Now, punta tayo sa salience. Now, the fourth criteria, salience, refers to the family's perception and evaluation of the condition or problem in terms of seriousness and urgency of attention needed or family readiness. Now, this is now the perception of the family pertaining to the existing problem. How serious, how urgent it is na maghanap tayo ng solution. Okay? At handa ba sila na gawain ito? Okay? Kaya dito, pag sinabing salience, makikita niyo yung choices doon. Pwedeng ang family, they see it as a problem, problema. needing immediate attention. So problem ito, kailangan gawaan ng paraan kaagad. Pwede naman yung iba, problem lagi siya ma'am, pero saon man namo, wala may mahimo. So it does not need immediate attention. Naanad naman mi ani ma'am, among hagdanan, wa man pud mi nahulog diri, kadi na lang sa wala may mahimo. Ana. Or ma'am, ang tubag, pag-ask ninyo kanang ma'am, gina-consider ba ninyo ni siya nga problema? Okay? Mo ana ang family na wala jud mi nang problema ana sir. Lahi gyud ang amo ang priority. Okay, wala na naanad na mi na dili na siya problema para sa amo. Okay, so yun ang kanilang perception regarding the problem. There's no urgent need to do something about it. It's not serious to them. It's not a problem to them. They're not bothered at all. Okay, so keep in mind, pag sinabing salience, it is the family's perception and evaluation of the condition. Hindi tayo. Okay, kung kita na problema gina sa tuwa, needing immediate attention, dili ni pwede. Okay, na magtiniil lang ng mga bata, kailangan palitan ng tsinelas. Ang problema sa ilaha, wa may pampalit og tsinelas. Problema gud na siya pero wa may pampalit unsaon. Unahon sa ang chicha kay walay kaon. Kaon say una, bahalag magtiniil basta naigi kaon. So ana gud ang ilahang mga perception. So yan po magba-vary po ang ating rating. So ito na yung sinasabi ko sa inyo. Now, if for example, ang problem can be, ang nature of the condition or problem is categorized as health deficit, meron po siyang score. So wellness 3, health deficit 3, health threat 2. Pag stress point po ito or foreseeable crisis, 1 po ang score. Ang weight po natin is 1. Constant po ito. Now, modifiability, these are the options. Easily modifiable, you give a score of 2. Partially modifiable, you give a score of 1. Kung hindi talaga ma-modify ang problem, 0. Ang weight po is 2. For preventive potential, high ang preventive potential. If we can do something about it, we can prevent the consequences that may happen. Okay? Kung mahimuan og intervention. Now, pwede rin ay moderate lang, considering those factors. Okay? The gravity of the problem, the duration of the problem, or ma'am, baba yun ato ang preventive potential. Kahit na magawaan natin ang interventions ngayon, but then, the problem existed for quite some time. Grabe naka-expose ng mga family members sa second-hand smoke. Okay? Or pwede sabihin nyo, ma'am, low lang po talaga ang preventive potential nito. So, ang scoring po natin, 3, 2, 1. Ang weight po is 1. Now, for salience, so sabi ko kanina, if they see the condition or problem needing immediate attention, we give a score of 2. 2 ang score, ana. Now, if a condition or problem does not need immediate attention, we give a score of 1. Pero if it is not perceived as a problem or condition needing change, we give a score of 0. Ang weight po, 1. How to compute for this? Okay? So, ang gagawin po natin, halimbawa, yung kanina, threat for cross-infection, PTB, as health threat. O health threat man to siya, di ba? So, what's the score for health threat? Okay, based on the list. 2. Okay. So, pag-compute natin, you are going to get the actual score, which is 2, over the highest score, which is 3. And you multiply it with the weight. So, 2 over 3 times 1. Kuha? Let's talk about modifiability. Ma'am, partially modifiable lang po ang problem natin. So, what's the score for partially modifiable? 1.
1 po.
What's the highest score?
2. So 1
2. Then multiply it with the weight, which is 2. Ana, no? So 1 over 2 times 2. Actual score over highest score times the weight. That's how you're going to compute. Preventive potential. Sabihin natin, ay ma'am, moderate lang po ang preventive potential. So the score will be 2 over, what's the highest score? 3. Multiply it by 1. Let's go to salience. So sabihin nila, ma'am, it's a condition or problem needing immediate attention. So the score will be 2 over the highest score, 2 multiply it with 1. 2 over 2 times 1. Lahat ng 10 problems po, you are going to compute. Nakuha po? Ngayon, ganito ang magiging ano niya, kakalabasan niyan. Iyan. Gets? So for prioritization of problem, so on top of your table, okay, you're going to present it in a tabular manner. This is going to be the content. You write on top what is that health problem, family size, beyond what family resources can adequately provide. Okay, as health threat. Now, you go over with the criteria. Criteria number 1, nature of the problem. Okay, let us compute. This is health threat. So the score is 2 over the highest score for nature of the problem, which is 3. You multiply it with the weight. Kanang weight class, constant na gina siya. Okay? 1 ra gina ang weight. So 2 over 3 times 1, that's 2/3. And then you have to make a justification. Bakit siya health threat? It is a health threat for limited resources, may affect family's task to provide the basic needs of its members, such as home, food, clothing, which are all necessary for survival. Example, yan ang justification natin. All right. Then, next to that, anong next na criteria? Next to nature of the problem. Modifiability of the problem. Tama po ba, student? Ayan. So, sa modifiability, same na naman. Is it easily, partially, not modifiable? O kunyari, nakapag-decide ang grupo, huy, easily modifiable lang to. Okay, di 2 over the highest score, 2, multiply it with the weight. Okay, that's the score, 2. Then you have to justify. It is easily modifiable with the health teachings given by the student nurses. Alternative sources of income can be an option among the other older members of the family to augment to the increasing financial needs of the family. Example lang yan, ha? So, next. Ano yung next criteria after modifiability?
Preventive potential, ma'am.
Correct. Preventive potential. So, salamat naman. May iba nang sumagot. So, dito, ay high daw ang preventive potential. So, 3. 3 over 3. Kay 3 is the actual score, 3 is the highest score, multiply it with the weight. Now, it has a high preventive potential. The family can be given health education pertaining to the different types of family planning methods so as to avoid additional pregnancy. They too can work hand in hand to improve their livelihood by engaging into some part-time jobs or services. Now, let's go to salience. So, what's salience? The perception of the family regarding the problem. So sabi ng family ma'am, problema gid siya. Ang problema gid niya ni kailangan din mang pangitaan og pamaagi. So basic ra jud tayo ang justification katulang interpretation sa inyong result. Okay, so score. So 2 over 2, which is the highest score, multiplied by the weight, which is 1. So the family perceives it as a problem needing immediate attention. And then lahat po ng score na ating na-compute, we are going to total. We have to create a summary of those particular scores that we give, okay, for every criteria. So it's 4 over 2/3. Halimbawa, o next problem na pud ka, inadequate living space. Balik na pud ka, nature of the problem. Okay? So that's the first criteria. Then you have to write now the score, the weight, and then your justification. So, lahat po nung 10, gagawan niyo po ng table na ganito. Nakuha? Students? So that, pagkatapos ng 10 na prioritization, i-arrange ninyo. You're going to encode in a separate paper sa manuscript ninyo the list of prioritized problem. So, kumbaga, mag-create kayo ng summary. Number 1, kunyari, ang lumabas doon, threat for cross-infection. Okay? Okay, let's say PTB as health threat. So, ang score niya is 4 over 2/3. Next na naman, improper garbage disposal as health threat. What's the score? Kunyari, 3 and 2/3. Okay, third na naman. Lahat puro naka-arrange na po. Yun yung summary ninyo sa inyong 10 na identified na health problems. So, madaling makita. So, pagtingin ng CI, okay. So, ito pa lang gagawa ng NCP, ang first 3 or first 5. Kasi ideally, first 5 talaga eh. Yun po ang gagawa ng FNCP. Pero ngayon, 3 NCP lang naman ang gagawin ninyo. But then, the 10 prioritized problem, you are supposed to make this table for every problem, wherein the criterias are reflected, the scores, and then the justification for the scorings that you give will also be reflected. Questions so far, students, regarding this one? So, huwag kalimutan yung mga factors that can help you determine ano po yung score na ibibigay ninyo sa inyong preventive potential at saka sa modifiability of the problem. Okay? Hala, murag wala naman ni naningog. Okay pa ba mo, student?
Yes, ma'am.
Yes, ma'am.
Sige. Anong
Yes,
question
ma'am.
ninyo? Baka may question kayo before tayo mag-proceed. May question ba? Regarding prioritization of problems, kasi isa ito sa mga requirement din or content ng family case study. You need to do prioritization. Wala na? Kaya na ni? Kabalo na mo-identify yung health problem. Kabalo na mag-identify yung family nursing problem. So pag may health problem na, you prioritize para makagawa na po kayo ng inyong FNCP. So may sample na tayo ng FNCP. So I think you are somehow ready to make one. Okay? Depending upon the case that you will encounter in the community. So kung wala na kayong tanong dito, proceed na tayo. Now, eto kanina, yung sa family developmental task, this is what you are going to do, class. Okay? Eto po yung sa family stages natin or family developmental task and stages ba yun? Yung kay Duval, family stages and task. Let's say, for example, beginning family, no? This is the format of your entry. Naka-table din po. Kunwari, beginning family, you write down the task. Task number 1, number 2, number 3, number 4. And then, may options dalawa. Achieve, not achieve. So, kung achieve, okay, i-check si achieve. Not achieve, okay? So, ito ang ating i-check. Okay? So, not achieve, hindi na-achieve ng family natin. So, yun yung dalawang options natin. So, kung achieve po, check lang natin yung achieve. Kung not achieve naman, dito ang i-check natin, not achieve. So, but then you have to make justification. For example, this one, beginning family, the first task is establishing a mutually satisfying marital relationship. So, based on your assessment, achieve naman po ito ng couple. So, justification, despite their busy schedule at work, the couple allocates time to be together during weekends. They usually go out on a date, they share tasks and responsibilities at home, they maintain an open line of communication, and resolve any concerns as husband and wife. Achieve. Second, ano na ang next nito sa beginning family? So, same process lang po ang gagawin natin. So, you have to enumerate all of the tasks and then decide whether it is achieved or not achieved, and you provide justification. Question po dito. Meron ba? May listahan naman kayo nito, di ba? The different developmental stages and the tasks of the family according to Evelyn Duval. Kaya yan, madami kayo masyadong i-prepare, no, for your data gathering. So, I think you need to do tasking. Like, for example, this one. So, sino kaya ang magtatanong pertaining to this assessment regarding the task of the family in accordance with their family stage or developmental stage according to Duval. So, tasking yun mo, ani. Kaya dili man pwede na isa lang ang mangutana. Siya na lang all throughout. And then, mag-ano din kayo, mag-secure kayo ba ng maayos na papel? Wag yung kung anong-anong papel lang ang sulatan. Ya, mo chat dayon kanang duol na bito sa submission. Ma'am, nagbaha diri sa mong balay pa unya. Nawala ang papel, ma'am. Mag-na-appeal sa baha, nalutaw. Na, katay, nagitani. So, back up din kayo kung may mga info kayo, di ba? So, wag lang yung isa lang yung may hawak ng mga information. So, at least meron din yung ibang classmates ninyo. So, kaya mas better kung mag-tasking kayo. So, okay. Ako ang magtatanong regarding dito ng mga questions. Wala nang tanong with the family stages and tasks. That is how you are going to present this in your manuscript. And then you will defend it. Ngayon, dito tayo sa inyong Ecomap. So, ano ba ito? So, makikita nyo naman, may mga example nito sa Google, no? A classic tool that is used to depict a family's linkages to its super system. Families, formal, informal networks, neighborhood. So, we said that family is a system, diba? We function as a unit, it's a system. So, within the family, we have different family members, they perform different roles, okay? In order to achieve all of those or perform all of those health tasks. But in the event that there is somebody who is incapable of doing such, the rest of the family members are also affected. Okay? So, pwedeng halimbawa, merong conflict between husband and wife. Okay, the children are also affected. What about parent and child na subsystem? Kung meron din silang problema, the rest will also be affected. But other than that, outside, we also have these so-called families, formal and informal networks. So, yung mga informal networks natin, kagaya nung linkages natin with our friends. Okay, saan ba tayo laging pumupunta? Kaibigan natin, kapitbahay natin, or sino bang pinupuntahan natin from time to time? May mga existing din na mga formal networks, no? It could be represented through the various, let's say, institutions, facilities that is available within the community. Like, for example, school, San Pedro College. Isa may nag-add to permanente sa San Pedro College, no? So, isang student. Kunya, si Miss Cabriadas, always siya sa San Pedro College kasi student naman siya doon. Okay? So, we will try to establish like what is present nearby. Are these resources available in the first place? If they're available, are they utilizing these resources? Or meron ka nakita dun, bakit kayo dito pumupunta? We don't have any choice kasi po, wala namang palengke dito sa amin, kaya dito na lang kami sa sari-sari store. There we purchase some items, okay, for cooking. So, or meron kayong palengke, bakit dito ka bumibili? So, titingnan din natin what's the reason, like, most of the time, doon na lang sila sa maliit na talipapa rather than going to Agdao Public Market. Kasi mas malapit or hindi na sila pumupunta sa malayo because additional na naman doon, gastos kasi magbayad pa ng tricycle or what. So dito lang sila sa malapit. Yung mga ganun. Or may school, bakit pa nag-aaral sa malayo? You will be wondering why. There's a daycare center. Yung pala, hindi ang maganda ang kanilang relationship with the teacher. Ay, nag-away magud niya ng teacher sa daycare, ma'am, kay favoritism siya. Akong anak wala gi first owner nga mo ay pinaka-bright din ha. Una ni balhin na lang mi na Miss Santa Ana daycare. Kalayo ba nila? So doon mo malalaman din what's the relationship of the family with this different formal networks or ano ba? Halimbawa, may chapel malapit sa kanila, pero wala sila nagasimba sa chapel. Never sila nag-aadto. Anong wala mo nagasimba diha, ma'am? Ani, nagasimba diha, ma'am, adto man jud mi sa San Pedro Cathedral. Dili mi nagasimba din na. Anong reason? Okay? Or may sila ay wala man ay kuan, ma'am. Nalang na dihay ka ng chapel pero wala may mass ginaheld din ha. Okay? So, yung pala may kumbaga there's lacking with the available resources. So, merong structure but then wala namang mga ceremonies that is conducted on that particular area to address the religious needs, okay, of the family. Mga ganon. Ma'am Al, na-appeal na ba niya, ma'am? Ang Ecomap? Pasiguro,
Wala pa, Ma'am Jack.
Wala pa.
Wala pa po. Oh.
Ani siya na illustration. Dapat na may mga legends class. Halimbawa, this represents the family man daw. Halimbawa, diba ko mag-drawing? Naman ko na siya, murag ka ng bilog dari sa center ba? Naligay ko kabalo mo kayo. Sa bilog siya dinana. Uni siya, this represents the family at the center. Mother, father, eldest na anak na lalaki, tapos yung second child nila babae. Now, these are the existing, okay, mga informal, formal networks within the community. Now, we're going to determine, okay, how's the relationship of this family over this existing, okay, networks. Pwede pa mo dungan dire example lang di siya, no? Now, naay legend din ani, ang nakabutang lang diri is they would visit sometimes, always, never. Or I think if you, pwede rin naman kayo mag-change no, ng inyong legend. We used to have kasi this one, sometimes, always, never. Pero in some other sources, kung mag-research mo din ha, pwede man good, we are trying to establish man good the relationship of the family over these existing networks. So within the social environment. So pwede ring positive relationship, they have